We're making a lot of advances, I think, in DNA testing, and some of it is not cost effective at this time, but some of it is. There's a book out called the Heart Attack Gene, and I read it recently, and there's like 5 different genetic tests you can do, and it's probably a reasonable price, $350 to $400. But you can evaluate your risk factors for having a heart attack and what you need to do. I think that's going to be very helpful, and I'm just trying to ask my manager to try to contact that company so that I can start doing that testing in my practice. We got heart disease is a killer, you know. I mean, women and men are having heart attacks and strokes, and we need to do whatever we can to, number one, recognize if we have a problem, and if we can catch it early enough, we can do something about it. A lot better than wait till you're having a heart attack or blood clotting on the table in the emergency room, you know. So genetic testing is good in psychiatry. We have a lot of genetic testing that's mostly associated with a lot of times where what is metabolized, which drugs are metabolized, antidepressants, how well they're metabolized, if they're mildly metabolized or greatly metabolized, moderately metabolized, and there are some indication of which drugs that would be better for people to use. And so we're doing more and more of those guidelines. I think Medicare, I know Medicare is paying for a lot of it, which I think is probably, I don't treat a lot of Medicare people at this time, but so if I'm there now on my Medicare card, so I guess I'll start treating them. But it makes it really difficult. But one thing they are doing is paying for some genetic testing, particularly when you have people come to me and they're on 5 or 6 drugs, and doctors keep putting on drugs. And I think the 4th leading cause of death is iatrogenic, or from all the drug interactions that we have. So I think it's important for us as physicians to learn the side effects of our drugs and the interactions of our drugs. And so we are making some advances in those areas, but we've got to be using them too. And on the other hand, we're pushed that, hey, it seems like if you're not a senior, I'm having a hard time getting those tests paid for by insurance companies. So genetic testing is a thing of now and of the future, and we just got to use wisdom and how to and have some experience in how to interpret it and when to do that type of testing. But I really feel good about the heart testing genes and the risk factors there. And I think people with any kind of their parents or family have heart diseases and illnesses, that would be something to consider. So in my clinic, I want to try to invite all specialties. I want to try to cover everything that we can do to help people. So having a cardiologist here would be great. Just had a yoga studio, a yoga lady who teaches all different types of yoga to come and have a space nearby me to help people learn how to relax and to recover. And so I think we've got to reach out and expand our thinking and not be so narrow-minded as physicians, and be more holistic and realize there's got to be something to some of these things, and just to say what we were taught, hey, this isn't helpful, this is not real, I don't believe in that, when you haven't even tried it. But what I've found a lot of times, the people in my organization, Anti-Aging for Medicine, that most of them were really sick and they'd been to doctors and they were kind of hopeless, and they learned another route, and they're the ones that are up teaching now because they learn how to fight their diseases.